Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sarah Figueredo. How are you, doctor?
Hello, Louise. I'm super well. Thank you so much. And how are you doing?
I heard you were on a trip.
Yes, we were at a conference in India, New Delhi, and it was a whirlwind. We were only there for about 6 to 7 days, and we tried to catch all of the sights and sounds as much as we possibly could. But we're
Awesome.
back now, and doing some stem cell therapies.
Excellent, doctor. So, in this case, we are going to talk about diabetes type 1. Is that correct, doctor?
That's right, Louise. We wanted to specify diabetes type 1 because, there are several types of diabetes now, type 2, even type 3, and they're all, they differentiate depending on insulin dependence, onset, a number of different factors. But in this case, with diabetes type 1, we're almost always talking about a juvenile onset or early onset, and we're always talking about insulin dependency. And basically, what the type 1 specifies is that the pancreas is not producing the insulin required to reduce blood sugar from our food in our blood. And basically, what's happened is there has been damage to the pancreatic cells, the islets of Langerhans cells, the beta cells that produce insulin, because there has been antibodies, or there are antibodies that are attacking those cells and basically destroys those cells, and thus the body is unable to produce insulin in response to blood sugar. Now, why this happens, we just don't know. We don't know why autoimmune conditions even come about. So diabetes type 1 is a type of autoimmune condition. Auto meaning self, immune meaning the body is attacking itself. So it just sees itself as foreign for whatever reason, certain cells. So, and again, another example of another autoimmune condition might be multiple sclerosis, where antibodies are attacking the myelin sheaths of nerve tissue. And then rheumatoid arthritis is another type of an autoimmune condition where the antibodies are attacking the cartilage of our joints. So that's basically the idea of an autoimmune condition. Now, diabetes type 1 specifically, we want to talk about because it is an autoimmune condition. And that makes it a little bit different in terms of how we address it with stem cells. So I'm glad that you pointed out that this is diabetes type 1 and not diabetes in general.
Okay. And can you tell us the process of the stem cells themselves? How do they work for, in this case, will be the pancreas?
Yes. So the goal is to get the stem cells into the body. We inject them a couple of different ways. We get them into the circulation of the pancreas, so it's directly to the pancreas, the stem cells, and we also put them in the lymph system. So the lymph circulation, which is basically where the immune system begins in our body. And we do that at the sites of the inguinal lymph nodes, right in the crease of the groin area, some of the biggest lymph nodes. And that gets into the immune system in order to address the antibodies that are attacking the pancreas and the beta cells of the pancreas. So that's basically the mechanism. What we're trying to do is we're trying to get the stem cells where they need to be in order to regenerate the damage that's been done. Now, it's really important, Louise, it's really important to keep in mind that this is a two-pronged approach. There are two things that we need to accomplish here. Number one, we need to stop the autoimmunity. Okay, so that's where we address the lymph system and we inject the stem cells into the lymph nodes. That's number one, to stop the autoimmunity. Number two is to regenerate the damage that's already been done. So to undo the damage. So two things are going on, right, with an autoimmune condition, is that the antibodies are attacking constantly, and the damage is being done because of that attack. And so we have to undo the damage in order to reverse the, uh, the damage and to regenerate those cells in order to produce the insulin. And then we need to prevent the future progression of the disease by shutting off the autoimmunity, or sort of modulating those antibodies that are attacking the pancreas. I hope that makes sense to you and our listeners.
Oh, yeah, it does. But I need to ask you, in case the listeners don't know, how many treatments do the patient needs of stem
Oh,
cells? Also, how many
oh,
sessions of stem cells do they need to?
okay. So you know what? Our goal is one session. The earlier we can treat this, the better. Our goal, what we do is we apply in various different modalities about 800 million stem cells in one stem cell treatment, okay, over a couple of days. And and we do this by applying stem cells IV right into the pancreatic circulation as well as in the inguinal lymph nodes. Now, I know your question, Louise. I know your and you know what? There are times where we can dramatically reduce the amount of insulin a patient has been using in just weeks. Okay,
Wow.
we've gone, yes, with Jordan Williams, one of our the UFC fighter, the MMA. I'm sure you've all many of you have heard of him. He came to us for treatment, and within about 5 weeks, we had reduced by a third the amount of insulin he was using. So that was that's quite phenomenal, and then it just keeps getting better. That's just early on, and then it keeps getting better. But what we do, I know your next question is going to be, what type of stem cells do you use, Doc? And that's an important question when we're talking about autoimmune conditions, because in that case, when we're dealing with autoimmune conditions, we really like to use endometrial stem cells, which are basically from the endometrium or the uterus of healthy young female donors. And we combine those with brand new, potent, non-toxic bone marrow stem cells as well, and or umbilical cord cells. And the reason why we like to use endometrial stem cells is that they're specifically geared to um, uh, doing a really good job and addressing autoimmunity. So we like to combine the endometrial stem cells with the other stem cells to get the count and to get the best of both worlds, basically.
Okay. And since we are already in the topic of stem cells, I need to ask you, for the new listeners, is our treatment safe?
Are these treatment safe? Absolutely. We have never had, the worst thing that can ever happen, the worst thing that can ever happen is you can go through the whole procedure, come down to Guatemala, spend your 7 to 10 days here, and see no results whatsoever. That is the worst thing that can possibly happen. Have we seen anyone get worse? Never. Have we ever seen anyone not see any positive results? Never. Okay, so that's pretty much the worst thing that can happen. And then there are, possibly the risk of infection. That's always a risk, even with an injection. Have we had any sort of even minor complications such as infection? Never. We've never had. We always take the all of the precautionary measures necessary for the safest, most effective results and treatments.
And can we say that the use of insulin will decrease, or?
or eliminate.
Yeah.
You know what? I'm going to tell you, with endometrial stem cells, we've only been doing that for about a year, almost 2 years, maybe a little bit longer. We haven't been doing it long enough to see the final result, because they can keep working. And but we have seen patients dramatically reduce by more than half the amount of insulin that they've used, and that's after one treatment. So a lot of patients are just happy with that. And if they had come back for a second treatment, perhaps we can get even better results. So that's where we have, that's how far we've gotten so far.
And also, you do provide other treatments. Are those included in the stem cell treatment?
Yes, absolutely. And I believe that one of the reasons why we have such phenomenal results, we always have a degree, some degree, whether it's 80%, 90%, 20%, we always have a substantial degree of improvement with every single treatment that we do. And the reason for that, I believe, is because we have a very comprehensive approach. We don't just do the stem cells and hope for the best and good luck. Maybe we'll hear from you or maybe you'll hear from us. No, we have a very comprehensive pre-treatment protocol that involves a nutritional detoxification, intravenous infusion with a cleansing, a liver cleansing, which just lasts for a few days. Once the patient gets here, we also do oxygen therapy in the form of hyperbaric or exercise with oxygen therapy. We also do age appropriate growth hormone therapy and a stem cell enhancement formula, which is a personalized herbal and mineral blend to address the patient and what we're trying to accomplish in order to keep all the stem cells and the whole body in the best possible shape for the best possible results before and after treatment. To save this, or to, last but not least, we also address the patient's well-being in the sense of mental, emotional, even spiritual, because as I've mentioned before, our well-being is not just our physical body. It involves so much more. So that's why lifestyle, stress, how we cope with stress, how we what's happening around us, what's happening inside of us, what's our emotional state. So those are things that we address as well to get the best possible healing.
Okay. And since we are doing those treatments in Guatemala, and a lot of people don't know what Guatemala is all about. You, as a Canadian, can you tell us what your impressions are about Guatemala, or what your comments are about Guatemala as a country?
Yes, absolutely. I've done a lot of traveling, and Louise, you know my background, Middle Eastern by descent, born in Africa,
Yeah.
Canadian citizen, studied and worked in the States and Canada and Europe, and now I'm living in Guatemala. So it's yeah. I've been, so a lot of people are familiar with Costa Rica, and they do a really good job marketing Costa Rica, and it is quite beautiful. But there is so much beauty and history um, in Guatemala that's been so understated. They just haven't done a good job marketing it, but it's so understated, and it's just an amazing, full of volcanoes, active volcanoes that you can literally climb safely, and roast marshmallows in the lava. And and then there are the Mayan ruins, which are just phenomenal. In that, I mean, if you're a Star Wars fan, Return of the Jedi was filmed in Guatemala at one of the ruins called Tikal, and then Antigua is a UNESCO World Heritage Site, um, which is a small town just out about 45 minutes away from the city, Guatemala City, and then the coffee farms, and so such a great percentage of Starbucks coffee comes from Guatemala, Antigua actually, and Coban. So it's quite interesting. It's a really a destination place. So there's a lot to do and see here. other than just coming down for stem cell treatment.
And
So
also, we will provide a chauffeur for all the
that's right.
transfers. Is that correct?
That's right. We provide accommodation. So with the treatment package, everything that I mentioned previously in terms of the whole stem cell treatment and the pre and post treatment protocol, as well as a personal driver and 7 to 10 days accommodations. That's all included in the treatment package.
And also, so you know, our clinic is located in one of the most residential areas in Guatemala City, so you'll be totally safe. Because
That's
I
right.
know people are a little afraid of coming to these countries, but that Guatemala is a really safe city, because that's the name of the city as well, Guatemala City. So, yeah, you'll be more than welcome to come to our country.
That's right. Yes. Thank you, Luis.
So, doctor, I don't know if you want to add something else to this podcast.
Nope, I think you do a pretty good job at uh, providing all of the contact information, and we look forward to hearing from our listeners as to any ideas what they might want to hear in our future podcasts, any questions they may have. So I'll let you give the information as to how they can contact us. Thank you so much, Luis.
Thank you, doctor. Yeah, by the end of the podcast, you will find all the information how to contact us. Thank you, doctor, and you have a wonderful evening.
Thank you, Luis. You as well.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo. That is on YouTube. Thank you.